It's my feel-good breakfast show.
Welcome back. This is your Feel Good Breakfast Show. It's a Tuesday morning and thank you for joining us. So good to be in your company. Now, annually, World Malaria Day is celebrated on the 25th of April, and this year the theme is End Malaria for Good. And this yearly event is an effort to raise awareness of malaria as well as find a way of raising funds for the treatment and prevention of the disease. And it's also a day to highlight the great achievements that have been made in the fight against malaria. And here to help us unpack what exactly malaria is, we welcome, of course, our trusted medical professional, Dr. Darren Green. Signore.
Tenore.
Good to have you.
Dr. DG.
Dr. DG, as we like to call him sometimes.
Yes, we are talking malaria today. I mean, it was last month I went to a malaria region, Malawi, so I had to make sure I get my tablets. But before I left, I had to make sure I know exactly what malaria is. Now, Dr. Darren Green, for those who don't know, how would you break it down? What is malaria?
It's a killer, a fatal disease that's caused by a parasite. And the parasite, basically, like the definition of a parasite is, lives off the livelihood of another living thing. And what this, yes, the host. And what this parasite specifically does, its name is Plasmodium. It gets into your bloodstream and lives on the red blood cells or the liver cells, the hepatocytes and the red blood cells, which we know quite well. And what it does then, obviously, is cause breakdown of those cells until they explode.
Wow.
And that then leads to the health picture, the clinical picture that we see.
Yes.
So obviously what makes it quite interesting is that it's an animal-born parasite. So it's introduced, obviously, by animals, and specifically the female Anopheles mosquito. Which is endemic, obviously, to certain parts of the world, which makes it very, very common amongst the tropical belt. If you have to draw a belt around the equator, so sub-Saharan Africa, South America, Southeast Asia, for example, as well, and sub-Saharan Africa. That's why they occur in those regions, because of the carrier.
Is that because there's something particular to that region or particular to this species of mosquito that naturally carry them?
The mosquito. So without the mosquito, you're not going to get the introduction of the malaria parasite.
And that's
into
how
the
it's
bloodstream.
transmitted?
That's how it's transmitted. And they call that stylus, the proboscis of the mosquito, as it launches down into your skin and lances at the skin.
Yes.
If it doesn't go all the way into your skin and then reach the capillaries or blood vessels, then obviously in the saliva of the mosquito is where the parasite form lives. And it then enters your bloodstream via the saliva of the mosquito as it drills down and obviously pierces the skin and gains access to the blood vessel. Starts then obviously introducing the parasite to swim in the bloodstream.
Wow.
Goes straight to the liver and then carries on from there.
An interesting question that was asked is malaria contagious?
No, so it's not contagious in the sense that you need to be introduced to the actual parasite by being bitten, or the parasite needs to be introduced into your bloodstream. So that's quite important to understand.
Yeah. All right. Well, we'll continue in our unpacking of the topic of malaria on this. The 25th of April, as we said, every single year is annual World Malaria Day, and we're trying to understand it, and we are already gaining some great understanding from Dr. Darren Green, and we look forward to more of your company and more conversation very shortly.
It's my feel-good breakfast show.
Our interesting conversations here with Dr. Darren Green as we talk about World Malaria Day, the theme of which this year in 2019 is End Malaria for Good. And we're finding out some very, very interesting stuff. And the next question we wanted to ask Dr. Darren Green, the signs and symptoms of malaria. What do you need to look out for?
So the big one is fever. When you have fever after visiting an area where malaria is endemic or rife, you need to be super vigilant. So obviously you could just have a normal cold or flu, because the symptoms range from having severe fever, headaches, body pains and myalgia, to obviously if it's cerebral malaria where it enters the brain and causes havoc in the brain, you could then have things like seizures, fits, convulsions, and even things like going into a coma eventually. But fever being the head indicator, because what happens is as those red cells that are attacked by the parasite explode, obviously in cycles, you often find certain patterns to the fevers, even with certain subtypes of the parasite. Some happen every 48 hours exactly on the clock. Others happen every 72 hours. And most people don't know that, obviously you can develop the symptoms from a week or two after being bitten by the mosquito, all the way through to more than a year later.
Sure.
For the dormant stages that can live, obviously, in the host and stay in the liver, for example.
Wow.
Is there a way to test for that? Because I mean, I went to a malaria area last month. I haven't had any symptoms. So is there a possibility it could be dormant in me right now?
Yes, it can be, certainly. And there are certain things that we can do with blood tests to demonstrate, obviously, the parasite. Normally, it's obviously easier to demonstrate the parasite when it's actually doing something to your red blood cells. And in your blood, and that we do what's called a thick and thin smear of the blood, where we look at it under a microscope. The thick smear being where you obviously look at the red cells itself to see if there's a parasite inside the red cell.
Okay.
The thin smear looking specifically just at a film of the blood looking for the parasite itself, and so forth. The liver obviously can be imaged with different means in terms of MRIs and so forth, but we're speaking about a microcellular level here, so unless it gets active, it's very difficult.
Yeah. Usually when you are traveling to a malaria-ridden place, as Zoe did, you are advised to take prophylactic treatment.
Correct.
Does that kind of guarantee you that you'll be 100% safe?
Not 100%. So some of the best available chemoprophylaxis out there covers you up to about 90%. There's still always that small chance, because you must remember there are certain strains of the parasite that are even resistant to the anti-infective treatment that we give. So you've got to know and research the area you're going to see which prophylaxis you should be taking. It's not just a thumb suck. And then there are a whole lot of rules that come in into whether you're pregnant, how old you are, what your side effects and side effect profile might be, and other conditions that affect the absorption of the drugs. So, and some of them you can take a day before you leave, others you can take, you have to take weeks before. So that all plays a role in choosing the right one.
Yeah, and making sure that you complete the course.
Correct.
As prescribed.
Correct.
Wow, fascinating stuff. And we'll continue having a chat about this. We talk about the people who are most at risk of contracting malaria and all these kinds of questions with Dr. Darren Green as we take a look and are aware, or made more aware of annual World Malaria Day on the 25th of April.
It's my feel-good breakfast show.
Welcome back. It's your Feel Good Breakfast Show. It's a Tuesday, and if you've been traveling, then you might want to be keeping an ear open for this segment. We're talking about malaria because the 25th of April every year is World Malaria Day, and the theme this year is End Malaria for Good. But in order to end it for good, we need to understand it better.
That's correct.
So, Dr. Darren, who is most at risk of contracting malaria?
Yeah, people that travel. Obviously to these beautiful areas where we want to view the wild and absolutely enjoy the low felt, etc. Obviously you need to know the maps of where you're going and know the endemic areas if you want to travel. So obviously children as well are also at risk. Children under the age of 5 are particularly at risk as well. You've also got to think of people that are immunocompromised, people with HIV, because in them this could tipple the scale so quickly that boom, you've just, you're going to have a fatality because of their immune status. So yeah, so it would be those populations that are at risk, the young, obviously, and also they don't necessarily take the necessary steps in protecting yourself from barrier protection from the mozzies when you're going away. So that's why parents have to take it quite seriously in terms of the repellents, the nets, the clothing, the long arms, the short arms, looking at dusk. So it's interesting that they're more active, obviously, at dusk and night time. That's when the female Anopheles mosquito actually goes on the hunt for her blood-thirsty experience.
As vampires do. I had a quick question when you talk about immunocompromised individuals. So, for instance, if you have a simple cold, right, your immune system is certainly compromised.
Yes, well, it's busy engaging at that time,
in
so
a fight.
it's busy active, correct.
And that does
it exposes you to other infections at that time. 100%.
So be careful even when you do have a little sneeze and you are traveling to these areas.
Well, we actually have a caller on the line right now.
Awesome.
We have Pat, sorry, Pat on the line. Good morning, Pat.
Actually, it's not really a question. I grew up in a malarial area all my life, and I've had malaria I don't know how many times, masses of times. But when we were kids, we used to live on first of all Paladrin, then Mepicrin, and then Liverquin, and we would have these every single day. We'd have, or some of them, Liverquin was once a week, and then even my aides had, shoved in their bottles so that they would have. Now you don't seem to have those kind of prevention drugs anymore. Why?
Thank you very much for that question.
Where does she stay?
Where do you stay, Pat?
I stay in Cape Town now, but I mean, I grew up in Kenya, Malawi, Tanzania, you know.
Okay.
So I've done sort of that area of Africa.
Yeah, thanks very much for
Thank
the
you,
call, Pat.
Pat.
We really do appreciate it. So let's talk, I guess the question now is what kind of preventative medication is there for
Yes,
people
yes,
living
100%.
in malaria-ridden areas?
Yes, so a lot of the areas specifically that are endemic, some of them that are there permanently don't even take prophylaxis. They only treat in terms of treating active infection.
Oh, wow.
In view of the fact that they know the symptoms so well that they only start treatment once the fever symptoms start. They know they must get to the nearest clinic and start medication, because obviously the side effect profile of taking medication every day for the rest of your life, if you're living in an endemic area, obviously is something that you then play off the risk-benefit ratio, and I think that's what she's alluding to. So yes, we still do use chemoprophylaxis, but those are mostly for people visiting areas. The people that actually live there are really psychoeducated in terms of the symptom complex and understanding that. And remember also that even if you are treated once, you know, the organism can lay dormant in your system for many years. And malaria is something that you need to look after your liver particularly and keep an eye on your symptoms, because your exposure and the risk with every single exposure and bite in that area can then obviously be increased with every bite. So in that case, I mean, she was saying once a week she'd have a normal bite, and so on. The people there normally are so well educated in those areas. Remember that we had over 220 million cases of malaria, according to the World Health Organization in 2018, and more than close to 500,000 deaths reported last year, and that's what we're trying to combat right now, and that's what we need to educate people about.
That's right, and that's why the theme for this year's World Malaria Day on the 25th of April is End Malaria for Good. Our lines are open, so feel free to call us. It's 021 430 9881. We'll be back with Dr. Darren Green shortly.
It's my feel-good breakfast show.
Oh, well, we are back with Dr. Darren Green as we continue our health chat this morning, as the 25th of April is World Malaria Day, with the theme this year being End Malaria for Good. We've been talking about the symptoms, the regions where malaria is more prone to. But Dr. Darren Green, if you've been diagnosed with malaria, first of all, how do they diagnose it?
Yeah, so the first thing is you'll experience clinically symptoms, particularly the recurrent fevers, general body weakness, malaise. Even your level of consciousness might be altered, depending on whether there's infections in the brain as well. And seizures, I mentioned as well. So you'll get the clinical features. You'll seek help from a medical professional. What they will do is examine you, check out the size of your spleen and your liver, as well as a few other systemic tests, and then do blood tests to confirm the presence of the parasite or not. But, you know, certain blood tests obviously look at the film to identify the parasite in the red blood cell. That's the thick film. And then the thin film looks at, just in general, in the peripheral smear of blood, looking for the presence of the parasite. And then there's what's called a PCR test, which is quite accurate in identifying, obviously, the components of that infection in the blood as well. And that's quite essential. And then you'd be then treated according to the strain or the subtype. You know, the most deadly one is falciparum, Plasmodium falciparum. The others are ovale, vivax, Nolisi is another one as well. And
I feel like it's like rapper names you're throwing out there.
So all of them have different, slight differences in their life cycle. Some of them stay dormant, so on. But falciparum, definitely one of the more malignant malaria agents in our setting.
We have a caller on the line, 021 430 9881, all the way from Robertson. This is Christina. Christina?
Hello.
Oh,
Yes.
is it Krishna?
It's Krishna.
There we
Hi,
go.
Krishna.
Got it. Great to have you on the line.
Kan ek praat?
Ja,
As jy wil, ja.
Dis welkom.
Okay. Ons gaan in Junie maand bietjie met vakansie na die Kleurwald toe. En my mense sê nou dit is die maklikste om net te smeer en nou nie te worry oor pille nie, want dit is nou wintertyd daarso. Maar ek is nou maar 'n bietjie bang. Is dit beter om maar pilletjies te vat, want my kindertjies is nou 4 en 2. En hulle is nou nie so goed op pille drink nie. Is daar iets anders wat 'n mens kan doen?
So Krishna is going on a family vacation to the Kruger National Park in June, obviously winter in the southern part of the hemisphere, and she wants to know whether it's necessary to take pills as such, especially for her little kids 2 and 4, or can you just smear cream on to keep the mozzies away, and will that keep them safe?
Yeah, so it works in layers of protection. The more things you do, the least their chances are. As I mentioned earlier, the cover of chemoprophylaxis can take you up to 90% of cover from preventing contracting malaria. But doing things like the clothing in your children, the nets, the insect repellent that's actually covered in the nets itself as well,
Yes,
the sleeping
yes.
nets, for example, are also they reduce the chance even more.
Yeah.
You do get preparations for children, specifically looking at things like chloroquine, for example, that are actually in liquid or syrup form. So that makes it a lot easier.
Yeah.
What's more important is to look at the profile of everybody going as a family or as a group, looking at things like pregnancy, because some malarial drugs are known to cause birth defects to your baby. So you have to find out, you can't just go and take anything from your pharmacist. Disclose that you are pregnant. Look at, obviously, your history of liver disease, if you've had any form, or kidney impairment, because it will affect the working of the drug. And then looking also as to, the specific area you're going to. Because some medications and prophylaxis might not work in that area because of resistance of that parasite in that area.
Yeah,
So,
yeah.
there's some wonderful resources, the NCBI website, the CDC.org website that you can go and look at. So I'd say, for me, I would do all of them because I'd hate on my conscience that I could have done something that I didn't.
Absolutely.
When taking a family and specifically the vulnerable young children into an area like that.
So best to over-prepare.
Than underprepared.
Layers and layers and layers. Get the cream on, get the spray out, put the plugs in, put the nets
What a good
out, wear the
question.
long sleeve, take the pills, take the syrup, all of which is minimal effort when you consider the alternative.
Especially cerebral malaria, obviously.
Oh, thank you very much, Dr. Darren Green. Always such a wealth of knowledge, and great to hang out with you
Thank
and
you.
chat
Thanks.
about all things health. Hopefully you found that enlightening. Thank you to everyone who called in as well. We'll be doing this again next week, Tuesday.